The next bill on the calendar for today is House File 25. The Chief Clerk will report the bill.
House File number 25, number 2 on the calendar for the day, an act relating to health.
There are amendments at the desk. If there is no objection, we will let the author explain the bill before we act on the amendments. I recognize the member from St. Louis, Representative Zalesnikar.
Thank you, Madam Speaker and members. Today, House File 25 is really a simple common sense bill. Oh, can you hear me now? Okay. House File 25 is a supporting women bill, and it's a very simple bill. And I agree with the statement that Representative Liebling stated, that people want the government out of their most personal decisions. This bill, members, from 2006 to 2023, for 17 years, let that sink in, 17 years. There was bipartisan support. There was a vote to establish positive alternative grants in 2005. Do you know what the vote was in this House chamber? 112 to 17. 89% bipartisan support, and some members are still here on the other side of the aisle that voted in this 89% bipartisan support. In 2023, House Democrats had the majority and chose to end two long-standing options for women. Two options. What are they? Pregnancy resource centers and maternity homes. What changed? I agree. Women still want the right to have government out of their most personal decisions, and they still want it today. They still want choices, and in order to have options, they simply need all three choices. Members, this is an issue where 80% of Minnesotans, regardless of party, believe that this is the right thing to do, and that's why it happened for 17 years. Let's go back to offering three options for true choice, like legislators before us did, in a bipartisan manner. Women deserve to have three choices. They need options to have choices, or they're simply, really, take the word choice out, because there's not choice. The word choice implies there are options. And members, that's exactly what this bill does. Thank you, Madam Speaker.
There are amendments at the desk. The clerk will report the amendment.
Her moves to amend House File number 25, the second engrossment. The amendment is coded A5.
I recognize the member from Ramsey, Representative Herr.
Thank you, Madam Speaker. In Representative Zalesnikar's words, as in her opening, she stated that this bill is about choice. The employees of these facilities should not be prevented from giving pregnant people the choice of necessary health care, such as abortion care. The A5 amendment strikes out the choice-limiting language, and so if you are for choice, you'll be voting green on this amendment. Thank you, Madam Speaker.
Discussion to the amendment, Representative Zalesnikar.
Thank you, Madam Speaker. And members, the reality is abortions are funded. That's not what this bill is about. This bill is all about restoring the other options that were cut 2 years ago, which is pregnancy resource centers and maternity homes. I urge you to vote no.
Representative Herr.
Thank you, Madam Speaker, and I do request a roll call. Again, if you look at the language...
A roll call being requested. I see 15 hands. There will be a roll call.
Thank you, Madam
Representative
Speaker.
Herr.
If you look at lines 2.16 to 2.25, this language specifically restricts these employees and facilities from giving people option. Again, as Representative Zalesnikar stated, this is about choice. Please vote green.
The clerk will take the roll. The clerk will close the roll. There being 66 ayes and 67 nays, the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Ryer moves to amend House Law number 25, the second engrossment. The amendment is coded A6.
I recognize the member from Dakota, Representative Ryer.
Thank you, Madam Speaker. This is a simple amendment. It requires that before providing services to a client, a woman's pregnancy center receiving a grant under this section must inform the client whether there are any licensed medical professionals on site. This is to ensure that people who seek services at these locations, which are often made to appear to be healthcare facilities, to have accurate information about whether or not they will be able to receive their care from a qualified medical professional. Thank you.
Discussion to the amendment. I recognize Representative Zalesnikar.
Members, I ask you to reject this amendment for the simple reason that this isn't something that's done right now. On the other side of the aisle, when we have money going to Planned Parenthood, and the reality is that this amendment is not what we're talking about. It's not what's necessary.
There's an amendment to the amendment. The clerk will report the amendment to the amendment.
Ryer moves to amend her amendment to House File number 25 as follows. The amendment to the amendment is coded A10.
I recognize the author of the amendment to the amendment, Representative Ryer.
Thank you, Madam Speaker. Before I forget, I'd like to request a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Ryer.
Thank you, Madam Speaker. This amendment to the amendment makes the posting requirement more specific. It requires that a crisis pregnancy center receiving funding from the state must display a sign at their facility saying, "No licensed medical professional on site," when no such staff member is on site. This is to address that frequently the crisis pregnancy centers do not have a licensed medical professional on site. A national 2021 analysis reports that only 16% said they had a physician and 25% said they had a registered nurse affiliated with their staff. In Minnesota, these figures were even lower, with only 9% saying they had an MD and 20% RNs. Many of them are part-time and or volunteers, and they may be licensed in an unrelated specialty. At the time this research was conducted, at least one crisis pregnancy center's medical professional was an optometrist. So I think it's important to be transparent, to give the people who are seeking care at these facilities the information they need to make an informed choice. This is about being honest with people who are seeking the services, and I ask you all to support it.
Is there discussion to the amendment to the amendment? Representative Zalesnikar.
Thank you, Madam Speaker. Members, let's be honest. We all know that there's no licensing for Planned Parenthood, like there's no licensing for resource centers or maternity homes. We all know there's no posting at Planned Parenthood, and there's no requirement on the other side. So let's be clear. This is ridiculous, and the licensing doesn't exist for either setting, never has. That's the fact. Members urge you to vote no.
The clerk will take the roll on the amendment to the amendment. The clerk will close the roll. There being 66 ayes and 67 nays, the amendment to the amendment is not adopted. To the underlying amendment. Representative Ryer.
Thank you, Madam Speaker. First of all, I ask for a roll call on the amendment.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Ryer.
Thank you, Madam Speaker. I'll be brief. I think this just makes sense to be fair to the people who are seeking services at an important, vulnerable time of their life. They go in with an assumption that they're going to receive medical care. Often there is no medical profession. Please support the amendment.
The clerk will take the roll on the amendment. The clerk will close the roll. There being 66 ayes and 67 nays, the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Gomez moves to amend House Bill number 25, the second engrossment. The amendment is coded A7.
I recognize the member from Hennepin, Representative Gomez.
Thank you, Madam Speaker. So the A7 amendment to House File 25 is really about precision in language. It's important in our work that we say what we mean and that the things that we put in statute actually describe what they're purporting to describe. So the A7 changes the name of House File 25 from the Supporting Women Act to the Misleading Women Act. So as you heard Representative Ryer talk about, crisis pregnancy centers go to great pains to make themselves appear to be medical clinics. If you walk into one of them, they feel exactly like a clinic. There's a little desk. There's some seating. There's usually like some old people magazines sitting there. Somebody with scrubs checks you in and they give you paperwork to fill out. And they're called things like care centers, resource centers, pregnancy centers, women's centers. There's one in Crystal that's not a clinic, that's a crisis pregnancy center that's called the Crystal Women's Clinic. They advertise on the outside of these things, free pregnancy tests, free ultrasounds. So someone who walks into one of these things has every reason to believe that they're going to come into contact with legitimate medical care from a legitimate medical professional. So when I went into one of these things, when I think I was 18, I might have been 19, it was that summer that I turned 19. I was greeted at the desk by a woman wearing pink, I wear like pink or lavender scrubs. If you're a woman and you've been to a women's clinic, they have like the special lady scrubs. So she had the lady scrubs on and a stethoscope around her neck. We went back into the back room, and I thought, since I was in a place that looked and felt like a clinic, that I was going to get a pregnancy test that was like a lab-confirmed, legitimate pregnancy test. And instead, what I was handed was an over-the-counter pregnancy test, available 2 for $1 at Dollar Tree. I went and I took the test, and we sat there. I was across the table from this woman. And she just kept asking me, what are you gonna do if you're pregnant? Telling me how wonderful, she was a mom, sharing, some of stories of her own about her kids, which I thought was weird because I hadn't had like a nurse say something like that to me before, but it didn't exactly register at the time. And the pregnancy test was negative. I was in college at the time. I went, the CPC that I went to was right, basically by the U of M, in the area where college students all live, which is very common for these things to be placed in communities like that, where would have been a lot of young women like me who were in a situation like I was in, where I wasn't sure if I was pregnant. So it told me that my pregnancy test was negative. And that was wrong. I was pregnant. And weeks passed. And so I was not supported by this fake clinic. I was deceived by them. I was misled. I was deceived and misled by an organization that I had every reason to believe was legitimately a medical clinic, and that I had every reason to believe was staffed by a credentialed medical professional. And giving people false information about something as important as whether they're pregnant or not, or any medical information, can be it can be a fraught thing. It can lead to bad outcomes. If somebody doesn't know they're pregnant, there are things you're not supposed to do when you're pregnant that they could do. So the deception and the misleading practices of these organizations are not incidental. They're core to their mission. Misleading and deceiving women who are in a difficult situation is core to the mission of these organizations. And so we should call them by their names. And so in the interests of precision of language, I would encourage a green vote on this amendment. Thank you, Madam Speaker.
Discussion, Representative Nash.
Madam Speaker.
Madam Speaker, I would request a roll call.
Representative Nash has requested roll call. Seeing 15 hands, there will be a roll call. Representative Nash.
Thank you, Madam Speaker. Well, I couldn't disagree more. I've spoken to a lot of folks around these pregnancy centers, and is it misleading, I'll ask you, to educate women on the use of car seats if they choose to keep the baby? It is not. Is it misleading to teach them about breastfeeding, of what's going to happen down the road? It is not. Is it misleading to teach them how to use formula or swaddling or how to find assistance now that they're going to be a mother? It is not misleading. Is it misleading on how to find assistance now that you've gone through this brand new thing? No, it is not. Is it misleading to talk to a new mom about how to help your baby get to sleep because it's a brand new thing to them? No, it is not. Is it misleading on how to find housing if you may not get to stay in the house that you are in? It is not misleading. Is it misleading in telling them this most important thing, that it is okay to keep the baby if it's your choice? That is not misleading. So I reject the premise of this amendment. It is not misleading to help a person who is trying to figure out which way is up. It is not misleading at all, and I'm glad that we have these places. It is important that we have these places because a lot of these young women who are going in there, they may have been kicked out of their house and they don't know what to do. These places are helping them out. Reject this amendment, members. Vote red.
Representative Zalesnikar.
Madam Speaker, members, fake and deceived are pretty strong words. Happens to be Women's History Month. I stand here and think, wow, How did Minnesota all of a sudden think that women are so naive that we're going to become this paternalistic state to tell them what they're going to think, where they're going to go, and they're not wise and smart enough to know? No, it's not a licensed facility, and it doesn't say that. It doesn't say it at Planned Parenthood, and it doesn't say it at a Pregnant Resource Center. It says Resource Center. They're not licensed. Neither one of them are licensed. So let's just be clear. And when we're telling people what we're expecting to have, this bill simply provides 3 options for women. That is what supporting women is. So I think women in Minnesota find a misleading Women Act pretty ironic. Because here's the deal, folks. We lost 2 choices 2 years ago. Do women know that? This bill is designed to support women, and members, I vote you to support women and to vote no on this amendment.
Representative Katiza-Watun.
Thank you, Madam Speaker. And the author of the bill has said numerous times, alluding that people at Planned Parenthood are not licensed medical professionals. It's just not the truth. I want to just correct that for the record. The body voted against an amendment to make sure that clients, patients who are coming to these facilities know whether or not that there are licensed medical professionals on board. The body voted against that. But at Planned Parenthood, the licensed medical professionals are just that, and I just needed to get that on the record. Thank you.
Further discussion, Representative Gomez.
Thank you, Madam Speaker. These facilities are unregulated. They are passing themselves off as medical facilities. You can read off what the intent of them is all that you want. But if you haven't been in one, in a hard situation, and gone through that process, believing, based on it looking and quacking like a duck, thinking that it is a medical facility, then, words on a page are one thing. But in practice, these facilities do not provide medical attention. They are not regulated by the state. Your personal data is not protected in them. Because there is no requirement that there's a medical professional on site, HIPAA protections are not in place. Please vote green.
The clerk will take the roll. The clerk will close the roll. There being 66 ayes and 67 nays, the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Bierman moves to amend House File Number 25, the second engrossment. The amendment is coded A8.
I recognize the member from Dakota, Representative Bierman.
Thank you, Madam Speaker. Members, as my colleagues have expressed in committee and here on the House floor today, it is abundantly clear that we need regulation in this space. Unregulated clinics can often not only be misleading, but incredibly dangerous. The A8 amendment is a starting step, giving some oversight authority to the Commissioner of Health to evaluate the health impacts of these centers, establishing some basic privacy protections, and saying that we are not going to provide state dollars to unregulated clinics when there are real, legitimate healthcare providers struggling to stay afloat. Members, I ask for a yes vote. Thank you.
Discussion to the amendment. Representative Zalesnikar.
Madam Speaker and members, I ask members to vote no for this. The reality is that neither setting in the comment that was just made of unregulated clinics. These are not clinics. We have licensed professionals that work in the clinics, but they are not licensed clinics in the same way that you would have in a medical facility. So, members, I urge you to vote no.
Madam Speaker, I request a roll call.
Representative Bierman has requested a roll call. Seeing 15 hands, there will be a roll call. Representative Bierman.
Thank you, Madam Speaker. And again, licensed personnel in the clinics is the difference between these centers and other centers. Regulation by the Department of Health. These are all important things on oversight. We tried to fix this bill in committee, and we're trying again today to no avail. Members, please vote green on the amendment.
The clerk will take the roll. The clerk will close the roll. There being 66 ayes and 67 nays, the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Purcell moves to amend House File Number 25. The second engrossment. The amendment is coded A9.
I recognize the member from Rice, Representative Purcell.
Thank you, Madam Speaker. The A9 amendment instead directs money to the Sexual and Reproductive Health Services grant, of which we've also been funding at the state for some time. The Sexual and Reproductive Health Services grants, this fund offers affordable access to family planning services and medically accurate information across the state. Every dollar spent on sexual and reproductive health saves the public $7. What a deal. In Minnesota, 37% of rural counties have no publicly funded sexual health clinic location in the county itself, requiring residents who need low-cost or no-cost health care to travel greater distances to receive it than their peers in the metro. Through outreach and education activities such as the small grant classes and health fairs, the SRHS grantees reached 91,165 individuals across the state with medically accurate information about sexual and reproductive health, as well as where to access more comprehensive health care services if needed. This amendment, should we adopt it, will make our money go further, and I encourage, I have a request for a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Purcell.
Thank you, Madam Speaker, and I request a green vote.
Discussion to the amendment. Representative Zalesnikar.
Thank you, Madam Speaker. And again, members, I request a no vote. The bill is to establish funding for pregnancy resource centers and the maternity homes. Funding for the representative's amendment is already existing and has existed. We're returning to fund resource centers and maternity homes, which existed for 17 years. That's what this bill is doing. I urge you to vote no.
Representative Purcell.
Thank you, Madam Speaker. To my knowledge, I think the crisis pregnancy centers that the underlying bill purports to support, when we revoked our funding from the state level, I think they're all still in existence. They've got private funding, and we did not fund the maternal homes previously. But I want to just give some quick stats. The We Are Clinic provides the only family planning services in a 60-mile radius serving 800 patients per year in Crow Wing County. Providing affordable family planning services is important in these rural areas where transportation, stigma, poverty, and lack of insurance may be more pronounced. And more than 65% of their patients fall under 200% of the federal poverty guidelines. One more fun fact that might get you to vote green for my amendment. In 2023, all of these clinics that received the SRHS grant funding, they screened 16,000 clients for chlamydia. Chlamydia is the most prevalent STI. It's an epidemic around the US and Minnesota. And this funding is important because it increases access to affordable testing, treatment, risk reduction, counseling. And this outreach work allows clinics to serve populations who are most at risk. While 15 to 19-year-olds make up 6.5% of the population, they make up over 25% of the cases in Minnesota. So let's support this great work these clinics are doing, and please, I encourage a green vote on the amendment. Thank you, Madam Speaker.
The clerk will take the roll. The clerk will close the roll. There being 66 ayes and 67 nays, the amendment is not adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 25.
Third reading. Further discussion. I recognize the member from Goodhue, Representative Altendorf.
Thank you, Madam Speaker. Members, as we're discussing this today, and I want to thank Representative Zalesnikar for bringing this bill through the House. It's an important thing, and it was very discouraging to see this body strip out this funding. When we talk about being pro-choice, choice, the definition is the act of making a selection when you are presented with multiple possibilities. And unfortunately, this body in 2023 made it a #1 priority to move abortion all the way to 40 weeks and to strip all other options financially that were given to something like a pregnancy center. Choice means something. It means that there's more than one choice. I was actually quite shocked to see these amendments that were brought forth. And it's concerning to me to see the demonization that's happening in this chamber of pregnancy centers, especially knowing that most people in the public do not believe this same way that you do. I ask you, members, we have many instances. Let's just take teaching. One teacher makes a dire mistake, they're in the news. Does that, and if you take 100 teachers, does that make all teachers bad? One police officer makes a mistake, and does that make all law enforcement bad? You know, as I heard Representative Gomez say, it sounded like she had a traumatic experience at a pregnancy center, and that's unfortunate, and I truly feel bad for anyone that did. Members, it is wrong to demonize pregnancy centers across the board, and I think you need to check your hearts on this one. I think you need to go visit them. You need to see what they're doing there. They have been stripped of all funding from our state. They fundraise. My husband sits on a board of a pregnancy center, and I can guarantee you nothing that was stated on the other side, from people coming to the door dressed in scrubs to wearing a stethoscope and pretending to be a medical professional, none of that is happening. And perhaps you should visit one. They fundraise. They support women. They educate. The clinic in Red Wing, if someone takes a class on parenting, they earn points and they can get things like diapers for their children. They can get formula. It supports mothers, it supports families, it supports children. I thought you were pro-choice. Again, if there was one bad thing that happened at a clinic, that is unfortunate, and I would feel bad and apologize. I would never want that to happen to anyone. But this rhetoric that just happened in this chamber and these amendments were literally slanderous on these pregnancy centers and the good work that they do across Minnesota. On one of the amendments, you said that we should make them a pro-choice center. Well, I spoke to someone who went to a Planned Parenthood clinic, and she had not made up her mind. She asked to have an ultrasound. Planned Parenthood did not do that for her. Planned Parenthood did not give her options. You want to talk about pro-choice? You want to offer an amendment saying that pregnancy centers should offer every choice? Planned Parenthood isn't doing that. The irony. I talked to another one that she said she cried in the waiting room of Planned Parenthood because she didn't know. And they escorted her out. Apparently, a mother who is not choosing to kill her baby is not welcome at Planned Parenthood. So the irony of you to say that we should have pro-choice, the irony is so demeaning to every organization that does good. We should be celebrating families. We should be supporting mothers. We should be supporting fathers. We should be doing everything possible to help them have a healthy baby through their pregnancy, to give them a good start. And that's what pregnancy centers in Minnesota do. That's what pregnancy centers in Minnesota do. I don't know why you're so hateful with pregnancy centers. I don't know why you don't want to give a choice to a mother who is crying at Planned Parenthood to go to another clinic to have an ultrasound to find out that it is a baby. I don't know why you don't want to give them that choice. But if you don't want to give them that choice, then take choice out of your name, because you are not the party of pro-choice anymore. Members, Representatives Lesnicar supported our clinics, and no matter how you try to demonize these clinics, they will continue on. They will fundraise, they will support mothers, they will support families. And maybe, just maybe, you should go visit one.
I recognize the member from Ramsey, Representative Hollins.
Thank you, Madam Speaker, and thank you, members. This bill is part of an ongoing and dangerous trend of dedicating public funds to crisis pregnancy centers. And I have visited pregnancy centers, and they are not as described by the other side of the aisle. I have also visited Planned Parenthoods for a variety of reasons, and in fact, they do offer a huge number of choices, and they sit down with folks and they ask them how they would like to proceed. So I really balk at the characterization that that is not provided. That is not fair. I've heard a lot about demonizing pregnancy centers, and I want to make sure that it is on the record that giving public funds to organizations that are offering nothing but deception and manipulation is not acceptable. It is not acceptable. Crisis pregnancy centers are organizations that seek to intercept women with unintended pregnancies who might be considering an abortion and prevent those people from accessing contraception. They like to give the impression that they are clinical centers, that they have legitimate medical services and advice, and yet they are exempt from regulatory, licensure, and credentialing oversight that apply to healthcare facilities. Please note, we are not looking to take away public funding for healthcare facilities. You want choice? You can go to a healthcare facility. Many of them are subsidized by the state, by insurance. There is access to real medical care and advice. That is what we want to make sure we are providing to people. The ideology of these centers, owners, and employees take priority over the health and well-being of women seeking care at these centers. Women do not receive comprehensive, accurate, evidence-based clinical information about all the available options. I'm hearing stories about one person's experience in a center and another person's experience in a center, but the thing is, I like data, and there was a study that was done, and that study shows that pregnancy centers outnumber abortion clinics in Minnesota by 11-1, and most of these centers don't provide comprehensive reproductive health care. In fact, only 20% of them have registered nurses on staff, and only 9% claim to have a physician on staff. When we are talking about women who are pregnant, who possibly didn't know they were pregnant, you need to have people who know what they are doing coaching you through that system. It's not enough to have somebody who just likes babies. It's not a daycare center. They're not babysitters. We're asking them for healthcare advice. And when you're asking somebody for healthcare advice, I want to make sure that they are licensed and that they know what they are doing. We have a responsibility, not just to birthing people, but to our society as a whole, to ensure that resources are being used to actually help, to truly provide care and support and options that empower women to make informed decisions about their futures. Crisis pregnancy centers are an egregious misallocation of funds. They do not serve women in the way they claim. They serve a narrow ideological agenda that often does more harm than good. Minnesotans should be trusted to make what should be private healthcare decisions in consultation with a medical provider. They deserve to be given accurate information and a full range of medical options. We cannot use public funds to restrict, control, or manipulate the information provided to pregnant women. Now, if you really want to help women, I have some bills for you. Comprehensive sex education to prevent unwanted or unplanned pregnancies before they even happen. Requiring insurance to cover all forms of over-the-counter birth control. Funding pregnancy centers that focus on postnatal care for Black and brown women and their babies. Those are women who have significantly higher risk of dying during birth or shortly thereafter. Requiring maternal health, death, and morbidity studies. Making critical investments in social determinants of health that influence maternal health outcomes like housing, transportation, and nutrition. And dedicating funding to grow and diversify the perinatal workforce to ensure that every mom in Minnesota receives maternal health care and support from the people they trust. Those are things that will really help women. Those are investments that we can make. And of course, I would be remiss if I didn't note that according to a 2019 Minnesota Department of Health study, Black mothers giving birth in Minnesota are twice as likely to die of pregnancy complications than their white counterparts. Twice as likely. Black Minnesotans only make up 13% of the birthing population, and yet they represent over 26, almost 27% of pregnancy-associated deaths. And Native Americans only make up 1.7% of our population, but represent 12% of the deaths. There's a real problem here, a problem that is not being addressed by crisis pregnancy centers. If we truly care about pregnant people, if we are truly pro-life, the life of unborn fetuses and the life of all humans, we absolutely need to stop funneling public funds into deceptive organizations that do nothing but harm and start investing in real solutions. You all know that we have limited resources right now, and we need to use them to build a system that gives individuals the opportunity to make informed decisions, to have their needs met, and to live their lives with dignity, freedom, and respect. Imagine if we took all the money being funneled into crisis pregnancy centers and instead dedicated it to organizations that help women. Think about the impact of funding real comprehensive health care clinics that provide prenatal care, postnatal care, family planning, full reproductive health centers. Imagine the difference we could make by investing in shelters, food programs, and social services that provide a lifeline to women who need support when faced with an unplanned pregnancy. Imagine the positive changes we could create by investing in mental health resources to help women navigate complex, emotional, and overwhelming choices they face without the pressure of manipulation. Just imagine what we could do. Please vote no.
I recognize the member from Olmsted, Representative Smith.
Thank you, Madam Speaker. Representative Hollins, thank you for that. That's where I wanted to center this conversation about crisis pregnancy centers. Starting off from a point where we do all agree that women, those who can become pregnant in our state of Minnesota, should receive the best possible medical care, medical advice, especially if they find themselves in an unplanned situation. And the real question is, what is the best use of our public funds to achieve those ends? That's what 25 is talking about. And specifically, whether these crisis pregnancy centers, as they call them, are the best use for grants from the state, from the taxpayers of Minnesota, to achieve those ends. So as I was pondering this situation this afternoon, I Googled here at the Capitol, crisis pregnancy center near me, as someone who might need these services and had heard that name might Google. The closest one is in Burnsville. I'm not gonna say the name of the organization, it's a women's center, and I started just browsing the website like anyone might do who might be in a situation where they would need the services they think are here. And the website touts free services, pregnancy consultations, testings, medical consultations, but I couldn't get any actual information on the website. It kept funneling me to a link to set up an appointment, set up an appointment, set up an appointment. And it never specified if there were going to be medical professionals on site or not. It just said, make an appointment. So I wanted to find out, like, what does this women's center do if you make these appointments? So I clicked the only thing available on the website, which is an About Us page. And I want to read you what it says there. We are here for you. This women's center is committed to providing free services, education, and practical support to anyone who lives in or near Burnsville and Dakota County. Our compassionate approach is what we aim to be known for because women facing unexpected or unsupported pregnancies deserve the best care available. Whether you are looking for information on abortion, pregnancy, sexual health, or parenting, you deserve a non-judgmental, remember that word, safe space to sort through your decisions and testing results. As a 501c3 nonprofit in Minnesota providing free services, we do not profit from your reproductive health decisions. Contact us to learn more. So that, there's nothing terrible in that description as much as it's worth. It sounds like a good place to get medical advice. But I wanted to find out more, couldn't find anything about their board of directors on their website, couldn't find out anything about who was working there, anything along those sorts. But I did see that it was a 501c3, and I'm on the taxes committee, so I know that means they have a 990. So I looked up the 990, I printed it off. One of the first questions in the summary says, briefly describe the organization's mission or most significant activities. Remember what I just read to you, what is public, what someone who's looking for services would read and think is going on in this center. But in their 990, their mission is described. It is to share the gospel of Jesus Christ and to protect and advocate for the sanctity of all human life, born and unborn, through the provision of abortion alternative services that empower mothers to choose life. That's what you're asking us to fund. It's a crisis pregnancy center, and this kind of practice happens a lot. And listen, religious convictions are something that you are allowed to have in our society. This organization is completely legal. I'm not saying that they're doing anything illegal here in setting up this nonprofit. And in fact, in some ways, the government and the state helps these organizations. It's a nonprofit. People can donate to them, get tax exemptions, all kinds of things. I remember growing up, we used to fill up baby bottles with change for our local crisis pregnancy center when I was growing up in an evangelical church. And I'm sure many people in this room have done that. But the question is public dollars. Do we want it to go to these sort of organizations? I didn't cherry pick this. If you think I'm cherry picking this, seriously, go Google and find the closest pregnancy center. It is this one, and you'll find all of this to be accurate. The question is are crisis pregnancy centers helpful in maintaining a safe and healthy Minnesota? I would say clearly it is not. If you want another example of that, let's go to a state that allows this, and allows this overwhelmingly, Texas. Texas, in the fiscal year 2023, gave $140 million to crisis pregnancy centers out of their public funds. Did it help them be healthier? Their women, children, infants born. If you look at infant mortality rates for that same year, Minnesota, under current law where we don't do that, actually ranks much higher. Our infant mortality rate is 4.5 per 1,000. Texas's is 5.72, with all of that money going to this crisis pregnancy centers. These don't work. Many times they're religiously motivated, which is fine for a nonprofit, but is not fine for a taxpayer-funded grant. This is not the best use of our resources. It's not the best use of improving the health of our women, our children, our non-binary people, anyone who can give birth in this state. Please vote no on this bill.
I recognize the member from Ramsey, Representative Herr.
Thank you, Madam Speaker. And I actually wasn't going to get up and speak today. I know everybody says that, but really I've been trying to stay true to that. But I couldn't help myself because I heard a lot being said by my GOP colleagues across the aisle, and talking about demonizing and how they're characterizing people who choose to have abortions. And I felt like it was really important for me to stand up and speak about my own abortion story. and that I was very young when my husband and I first got married, and we were pregnant, and all I had ever wanted being raised as a young woman is to be his wife and to have his children. And I didn't know what to expect or what to think of. It was my first pregnancy, and if you come from a culture like mine, we do not talk about sex, we do not talk about pregnancy, even though we want you to have as many kids as possible. And so when I started spotting, I didn't know what to do, and I ended up going to a crisis pregnancy center. Well, first I went to a doctor who I don't know, and I'm so young, and I wish I would have asked more questions back then, and I was college educated, and I didn't know to ask. And I asked, and they told me that I was pregnant, and I was spotting potentially because I had an ectopic pregnancy. I didn't even know back then what an ectopic pregnancy was. They didn't explain it to me. There was no Googling. And so they told me, we're sorry, and you're probably going to have a miscarriage. And so I didn't want to experience that. I didn't want to figure out where that would lead me. And so I started looking to see in the yellow pages back then who I could go to for help. And I ended up at a crisis pregnancy center who encouraged me to try to keep my baby, even though and maybe I didn't use the right words back then. Again, I was only in my early 20s, and they encouraged me to keep this pregnancy, and I just thought something wasn't right. And I ended up going to an abortion clinic, and it was nothing the way Representative Zalesnikar explained it to be, and that was over 30 years ago. I literally sat in that room and I cried because I did not know if that was the right decision for me. And these people in this abortion clinic said, we cannot give you an abortion because you look like you are conflicted. And they wanted to give me the resources to be able to understand what to do with myself. And I ended up deciding that an abortion was the best thing for me. And I look back now, and the shame that I carried because somebody told me I should carry this pregnancy, and that I didn't actually share my story, and my parents never knew until I told my story 2 years ago when I was 50 years old. We cannot continue to support organizations that do not give people true medical advice. And I want to bring this back to the amendment that I had, because I want to draw everyone's attention to the fact that these organizations will not be eligible for these grants if they refer women to an abortion provider for an abortion. That if your life depended on it, this organization could not refer you to somebody else to give you additional services. That is what you are supporting with this bill. And like Andy, I did as a tax person, I looked up a bunch of 990s, and I really tried hard to figure out financially what they were doing when they talk about these programs about housing support and supporting a baby after it is born. I saw very, very little. Most of the funding that goes to the organizations went to salary, went to paying rent, there was very little in programming. So I don't know what you are referring to when you are saying that they're providing all of these wraparound supports for women who are pregnant. And so members, I do just want to draw you back to this specific line that you did not vote for my amendment, which means now you are telling people that they should be going to facilities who, one, will not give them medical advice, true sound medical advice, but they won't even refer, they can't even speak of it if I see a woman is in need of life-saving medical attentions. Member, please vote against this bill.
I recognize the member from Ramsey, Representative Finke.
Thank you, Madam Speaker. And members, I rise in opposition of House File 25, right? Yes, 25. There are many reasons that I don't support these crisis pregnancy centers. You have heard many of my colleagues share beautifully, vulnerably about many of those reasons. But I want to share another reason that I don't support this bill, and that's because crisis pregnancy centers don't need our money. They're fine. They actually have a lot of money. I also looked up some of these tax reports. You know, we do our research, we get our data on our side, and I think it's really important for us to recognize there is actually like $1 billion industry in the United States that funds more than 5,000 pregnancy centers, crisis pregnancy centers across the country, and they're all doing okay. So whatever you think about these crisis pregnancy centers, you might think that they are designed specifically to trick women and queer people into getting into a space to avoid them getting the abortion services they're looking for, Or maybe you think that these places are dangerous, unregulated, non-medical service providers with no HIPAA protections and no real fundamental understanding of the services they're providing. Maybe that's what you think about them. Or maybe you think that they are part of an extremist, patriarchal, right-wing religious agenda to spread the gospel through what I don't even understand how that would work. We know what the missions are. Thank you, Representative Smith. The mission of these organizations, and I've looked at many of these as well, and I have visited them, and I have visited Planned Parenthood, and I appreciate all the medical care Planned Parenthood has provided me, and many other women and queer people across the country. We know what these places are. We know what they do. They say it. Spread the gospel. Spreading the gospel is not providing pregnancy care. You may think that those are the same things, but they're not the same thing. So whatever you think, they're deceptive, they are extremist, they are non-medical, maybe one of those, maybe all three of those, we should all be able to agree they don't even need our money. They're fine. They have plenty of money. Money is going to be hard to come by, I think, during this budget season. I think we're going to have to think really long and hard about how we want to spend it. And giving it to very well-funded, extremist, non-medical organizations deceiving our neighbors is a pretty big waste of money. So please vote no.
I recognize the member from Wright, Representative McDonald.
Thank you, Madam Speaker. I rise to support House File 25. When I first got elected in 2011, coming from Wright County and a pro-lifer, my goal, or at least what I claimed I wanted to do, is to defund Planned Parenthood with taxpayer dollars. And speaking to Representative Abler, Jim Abler was on health care. I was on health care finance and policy reform. And he said, no, Joe, sit down. You're a freshman. Sit down and shut up. I said, why? What do you mean? He said, we have a very important program called Positive Alternatives that many Democrats have supported for many years. And it does beautiful, great things in Minnesota, all over the state. Now, we had Governor Dayton at the time. We had the House majority Republicans, the Senate for the first time in 40-some years, Republicans. So we thought us pro-lifers had a really good opportunity. We still fought for life. But we realized there that the positive alternatives, that many politicians on both sides of the aisle, Democrats and Republicans, that worked together because they did see how good it did to help women. I don't know what you're talking about on your pregnancy centers and what centers you've viewed or visited, but nothing can be further from the truth that they are truly doing the work in helping women and men in need. It was a very, very important mission, and many Democrats supported it. Matter of fact, in 2022, Minnesota was named by Governor Dayton, or let's see, excuse me, Madam Speaker. I guess I'll have to go on memory. In 2022, August 10th, an article came out that Governor Walz claimed and said that Minnesota was the third best state in the nation to raise a baby. One of the key factors was that we took care of those pregnant mothers and the new mothers and fathers who had nowhere to turn to. We helped them all over the state, and we continue to do so. Us Republicans back in 2011 and 12, we fought and we tried to protect our pro-life movement. But we knew then that no one would ever get rid of positive alternatives, that funding would not be repealed until you had the trifecta. And then you repealed it. For 17 years, Republicans and Democrats who realized the value of life to protect women and children and babies was important until just 2 years ago. Governor Walz says that he wants Minnesota to be the best place to raise children and families. And these pregnancy centers do just that to people that are in great need. According to the Minnesota Department of Health, incidentally, that's our agency, their report on maternity homes in 2022 did this to help those in need. Since January 21 until its death that you guys voted on, the grants went out to 27 nonprofit organizations across 31 states. In those grants process from 2016 to 2020, over 32,000 women received services from pregnancy centers funded by those grants. They were able to help out 1,739 women get a car seat and attend a car seat safety program. 2,620 women received infant sleep safety education. 1,747 women who did not have a crib were provided a safe crib for their infants. Wouldn't you agree that's an important, very important mission? 1,624 women received shaken baby prevention education. And 1,527 women received child abuse prevention information. We have one of these pregnancy centers in Wright County. Several of us from Wright County have visited that center. They do beautiful work, very important work. And they have trained, licensed nurses on staff all times to help women and men. To say that this is a deception and misleading and deceiving, and call this, one of your members said it's a misleading Women's Act. I sure wish we'd quit talking like that. When we talk like that on this House floor, that's misleading. No matter how, if you like the bill or not, if you disagree with the Republicans or Democrats, that kind of talk is so misleading and deceiving and deceiving. We ought not to talk like that on the House floor, especially, members, on such an important issue that touches the souls of all of us. I just hope and pray that any one of you on that side, we need just one common sense person that will stand up and vote to protect women and babies, children and men. One vote. Sure would be nice in my 14 years or 15 years now to see at least someone on that side to join us in helping these pregnancy centers and helping women and mothers and children in the most deepest, darkest times of their need. They're doing some great things. I think you've been deceived in what these pregnancy centers do. Perhaps what they did back then, that this is now. Now they are helping women. They're helping babies. They're helping life. They're helping Minnesotans. And they're helping Minnesota become the best state to raise a baby. And we'll continue to do that we'll continue to do that, period. But we'll even do it better if you support this bill. Madam Speaker, thank you.
I recognize the member from Dakota, Representative Hanson J.
Thank you. Members, I hear this claim that this is supposedly about respecting the full spectrum of choices that are protected by our Constitution and our laws. But I do find it disingenuous to both use the frame of this being a pro-choice proposal while also asking to grant taxpayer funds to organizations who would be explicitly prohibited from receiving those funds if they are open, honest, and transparent about the full spectrum of options available in Minnesota. Instead, these grant recipients will be required by statute to lie, deceive, and mislead vulnerable people in crisis, despite the person's legal and constitutional rights to their choice of options. The gag orders specifically in this bill outright encourage hiding the truth of all options that are available for those who are in crisis and pregnant. So aside from the contradiction that I personally see in the frame of the pro-choice piece of this claim, I'm going to be a no vote on this for a few key and important reasons, among others. First, these orgs often refuse to support people simply because of who they are. And under this bill, they can choose if they want to refuse support based on religious or ideological beliefs. So, a bill that's seeking to support women won't support all women or people, because these orgs may withdraw or stop offering their support if they find out that someone seeking their support is queer, non-binary, two-spirit, an immigrant, an atheist, agnostic, different, or a different religion than them. Someone that is different is not unworthy. And just because their religion or their organization may deem someone's identity or existence on this planet sinful, unworthy, or immoral should not restrict them from accessing a service from taxpayer dollars that are not reflective of their constitutional and legal rights. Secondly, I will be a no vote on this bill because these organizations are directed to come up with their own way to protect data, which I find interesting. And it's mentioned that it should be in accordance with health data, even though these are not health clinics, which is further misleading to the public. The gag clause here limits the org from getting this money and from even referring people to the actual medical services that most actual medical facilities offer as a full spectrum of choices. I've never seen a medical provider or a facility who offers abortions turn around and refuse to offer or refer services for non-abortion services. But evidently what's good for the goose is not good for the gander here. Third, I will be voting no on this because I find it wrong to use taxpayer money to require and allow these orgs to exploit people's crisis and state of desperation as an opportunity to take advantage of their vulnerability and their trust and to mislead them about the full spectrum of choices available to them by law and by our Constitution right here in Minnesota. And lastly, I'm going to be a no vote here because of my own experience at one of these centers in Burnsville, ironically enough. When I was 17, I was pregnant, scared, and in crisis. I needed help telling my parents. I needed help getting prenatal care. I needed help securing baby products. I needed help finding a job, finishing school because I had dropped out, and making a plan for my future as a mom, AKA everything that these organizations claim to offer. I was not seeking or even considering an abortion. I had to find a ride to this place because I didn't have a license or a car. I went in alone, and I was terrified. I could barely even breathe sitting in that waiting room. But I knew I needed help and that my baby needed me to find and get that help. I was asked a series of questions, including my religious views, my sexuality, and my plan for my pregnancy. I answered them honestly because I felt like it was important to do that, and I thought I was at a medical clinic and wanted to provide them honest information. The person took the clipboard with the form on it, looked at my form, looked up, gave me a very dirty and intimidating look that I will never forget, and she said, "I'll be right back." She returned a few moments later and handed me a pamphlet about fetal development and said, "Here you go." I assumed they'd be back again soon for the rest of this appointment I was supposedly getting, and I waited, and I waited, and I waited. And finally, somebody came back out to the front desk, and she said, "Oh, you're still here." I said, "Yes, I'm still here. I'm just waiting to talk about the rest of the supports that I was looking for." And she said, first she looked at me like I had 3 heads, and she said, "Oh, honey, that's all the help that we can do for people like you. But we hope that everything goes great. Best of luck to you." And I left feeling humiliated, embarrassed, because I didn't understand where I was supposed to go from there. I hadn't told my parents, I was beginning to show, I hadn't gotten prenatal care, and I was 6 months pregnant. They had offered me a pamphlet of the services that they offered, and so I was really confused because why didn't I get them? If this is what they did, and this was what their mission was, what did I do wrong? Did I fill out the form wrong? I was a child, and I had no adult with me to help guide me on what I could have done differently, and I beat myself up about it for a while. I finally got the nerve to go to another place to try to get help, and thankfully my next visit was to Planned Parenthood, where I was connected to every single resource that I needed to take care of myself and my unborn child that I was so excited to bring into this world. I got prenatal care within days. I was given free prenatal vitamins. I got information about it was a copy, of What to Expect When You're Expecting, which I had never even seen that book, but it was really important to me because I had no adult around me to talk about this. I got support in learning about what I needed to learn to be a good mom. I learned how to breastfeed and how to prepare to bring my amazing little girl into the world. They also gave me tools and helped me tell my parents. So at 7.5 months pregnant, at 17 years old, I finally told my parents and got their support. So thankfully, Planned Parenthood saved my life and helped me figure out all of the information I needed. It's because of them that I stand before you today as a teen mom, turned first-generation college graduate, a homeowner, an independent and sole breadwinner for my family, and a successful professional, thanks to them. But no thanks to the Crisis Center who turned me away because of who I am. So perhaps if their proposed mission were to actually support all women, I would be standing before you today telling you a different story. But I'm not, because that is not their actual mission. Most of these centers are the same. I later discovered, as Representative Smith mentioned today, that this particular center their mission was to actively look for people who wanted to give their children up for adoption, and they were outspoken in the community about their homophobia. These exclusionary versions of Christian beliefs hurt because I was on the cusp of being born again, just like so many of these centers seek to do. It wasn't because of them that I found my way back to church. They actually put me the other way. Thankfully, somebody else did. So this is not rhetoric. This is not slanderous. My story is real. Chair Gomez's story is real. Chair Herr's story is real. Everybody who shares stories like this are real, but it does not surprise me that the Crisis Center's sympathizers and supporters would ignore our true lived experience of concerns about this bill because it was never actually about supporting all women. It was never actually about empowering all women with the choices that they are constitutionally entitled to in this state. It was never about supporting all women as they are, where they are, with what they need, from a place of integrity and sincerity. It's always been about restricting choice, using deceit as it's wanted, judging people for who they are, and discriminating in the public sector with public dollars in the name of religion. The best thing to take away from today's discussion is that, traumatic or wrong or not, the services that I and others went to these crisis centers to get were unnecessary because there were other people who stepped up and did the work, licensed medical professionals who connected me to real services that I needed, that made real change, that put me on a path to stand before you on the Minnesota State House floor and tell this story like so many teen moms and single parents would never get the opportunity to do. So I am glad that those services were offered to me from a place of honor and integrity, full disclosure and science, and whose actions prove that they actually support all women who are making all kinds of choices at all levels of urgency, because that is the right thing to do. Vote no, members.
I recognize the member from Anoka, Representative Scott.
Thank you, Madam Speaker. I want to cover a couple of things that have been said and just refute them. Representative Finke mentioned that these centers don't need our money. Well, news flash, neither does Planned Parenthood, and we fund them. Let's learn about them. In 2023, the annual report, this is from the Lozier Institute, Planned Parenthood reported nearly $2.1 billion in income and over $2.5 billion in net assets, an increase from the previous report. $997.5 million came from private contributions, up 44% from the previous report. Doesn't sound like they need our money. Taxpayer funding from the form of government grants, contracts, and Medicaid reimbursement hit $699.3 million, or almost $2 million per day, making up 34% of Planned Parenthood's overall revenue. Planned Parenthood's taxpayer funding has increased by 43% since 2010. Maybe we should think about not giving them money, Representative Finke. Doesn't sound like they need it. And let's talk about data and how it's held. If you just do a simple Google search of Planned Parenthood data breaches, you'll find several. One of the most recent was hackers threatened to leak Planned Parenthood data from September of 2024. So, over 300,000 devices were compromised that had multiple Planned Parenthood patient data on them. If we go back, you'll see that there have been class action lawsuits, there's been ransomware with Planned Parenthood, and there was something on here about Los Angeles. There was a really huge data breach there. Let's see, I think it was 400,000 people, patients' names were compromised at Planned Parenthood in Los Angeles. Yeah, here it is. 400,000. So let's talk about the safety of people's information. Planned Parenthood is a much larger corporation than these small, community-centered crisis pregnancy centers. And I am sorry to hear of the bad experiences that some of you are reporting and experienced. That's heartbreaking to me because the crisis pregnancy centers that I know of, that is not the way they treat people. And for every bad story that we've heard today, I've heard 5 or 6 or more stories of how these centers have helped people. Parenting classes, teaching them the basics of taking care of a baby. Because, like Representative Hansen, many of these are young women that don't have a lot of, they've never had to do this before. They're very young. Members, I've been here 16 years, and I've been here for some really harsh and difficult conversations, but I've never experienced anything like today and the demonization of people that want to do good in their communities and help women and men in crisis. I've had to get up and leave several times. I've just never heard such hatred toward these folks. And as was said on the previous bill, because there's one bad actor, do we throw out all of them and put them all in one negative bin? And that's not the way we should be thinking. These centers do a lot of good for a lot of people. Representative McDonald read off some statistics about how many women they help, about how many car seats they give out, about how many cribs they give out. I've been to their banquets. I've heard the stories of people that have been helped. So I know they are doing good. And I can't abide by the villainization of these folks. I think it's wrong, and I think it's ugly, what has been said here today.
I recognize the member from Hennepin, Representative Robbins.
Thank you, Madam Speaker. I rise in support of this bill. I know it's been a long conversation, and I just want to point out that several people have said that these organizations do not deserve public funding. And I find that really concerning. First of all, they received public funding with strong bipartisan support for 17 years. And the idea then was, because we provide funding to Planned Parenthood and abortion providers, we would balance that by providing funding to positive alternatives to abortion through crisis pregnancy centers. And that was a consensus that I think Minnesotans still generally support. So, but it was said, well, they don't need the money. They can just fundraise. Well, why isn't that true of Planned Parenthood? We give $24 million a year to Planned Parenthood of state taxpayer dollars. This is for $8 million. So already it's a huge imbalance, but I would certainly support my colleagues on the other side of the aisle. If you're willing to stop state funding for Planned Parenthood, I would agree, and we should just not give money to crisis pregnancy centers. But if we're going to give money to Planned Parenthood, we should provide the positive alternatives. Thank you, members.
I recognize the member from Hennepin, Representative Long.
Thank you, Madam Speaker. Members, as of Monday, we will officially be back to a tie in the State House. But rather than acknowledge this reality and begin working with us, the GOP is bringing up partisan divisive bills. Minnesotans want us to protect reproductive rights. More than 70% of Minnesotans support legal abortion, including big majorities in every single part of this state. It was said on the last bill that this used to be a bipartisan issue. Well, guess what? It still is, just not in the way you think. Politicians who want to outlaw abortion have increasingly sought to use public funding to fund crisis pregnancy centers. I used to live across the street from a crisis pregnancy center. It did everything it could to look like a medical clinic. It had a big sign out front, had a little red cross out there, but it wasn't. Make no mistake, these centers fake being women's health clinics to fool women into walking in. Staff or volunteers often wear medical coats or scrubs and falsely present themselves as healthcare providers, as you heard from Representative Gomez. Then they provide medically inaccurate information to the individuals they've tricked. They don't have health and safety standards. Because most of them don't have medical professionals, they aren't subject to patient privacy laws, including HIPAA. That puts at risk the privacy of individuals who come into the centers. The centers are not providing comprehensive reproductive care, as you heard from Representative Hansen. Planned Parenthood has been brought up a lot today, and I have the privilege of having a Planned Parenthood center in my district. In Minneapolis alone, they provide 2,300 birth control appointments, 400 annual exams, 3,500 STI visits. So let's not mischaracterize what these centers are doing. Crisis pregnancy centers can do real harm, providing inaccurate information that can lead to delays in medical care or pretending to provide medical advice when there is not licensed medical practitioner on site. They can endanger women by misrepresenting or misinterpreting medical evidence, as you heard from Representative Herr. Let's talk about choice. Anyone seeking healthcare services should be provided with unbiased, medically accurate information. As the American Medical Association puts it, the patient's right to self-decision can be effectively exercised only if the patient possesses enough information to enable uninformed choice. Manipulating information is a tactic used by those opposed to reproductive rights to try to influence the decision of women. This is not only unethical from a medical standpoint, it is often dangerous. Minnesotans should be trusted to make private healthcare decisions with accurate information in consultation with actual medical professionals. Crisis pregnancy centers do not need or deserve state funding. Vote no.
Recognize a member from Anoka, Representative Niska.
Thank you, Madam Speaker and members. House File 25 is a bill that restores fairness after the DFL's one-sided attack on pregnancy resource centers, an attack that we've seen continue in the discussion tonight. For 17 years, these centers received bipartisan support until last session when Democrats on a partisan vote eliminated their funding entirely. It's time to correct this injustice and make sure women and families have real choices, not just the ones that Minnesota Democrats approve of. Last year, Democrats cut every dollar from the Positive Alternatives program while handing abortion providers, not unbiased sources, millions more in funding. That's not pro-choice. That's one choice, abortion only. True choice means offering women real alternatives, not funneling them into one path. When Democrats fund organizations that only provide or refer for abortions while actively defunding maternity homes and pregnancy centers, it's clear where their priorities lie. House File 25 simply reinstates funding that existed for nearly 2 decades, funding that provides housing, counseling, parenting classes, and material support to women who choose life. Minnesota already spends millions of dollars for abortion-related services while refusing to spend a single dollar on alternatives. That's not fairness. That's not choice. That's a political agenda. Pregnancy centers and maternity homes provide critical, life-changing support to those who seek it. The real question is, why are Democrats so determined to silence and defund any group that doesn't align with their ideology? For 17 years, both parties agreed that women deserve access to a full range of pregnancy support until last year when that bipartisan consensus was shattered. House File 25 simply restores that bipartisan consensus. If Democrats truly believed in choice, they would support this bill. Members, I urge you to support House File 25. Let's stand for real choice. Let's vote green.
I recognize the author of the bill, Representative Zalesnikar.
Thank you, Madam Speaker and members. We've had a lot of discussion, and I appreciate hearing the statements and the comments and the experiences from both sides of the aisle. At the end of the day, I think it's important for members to remember that for 17 years, before I came here, and maybe before some of you came here, but we do have members that were here on both sides of the aisle when this was a bipartisan discussion. Unfortunately, it changed 2 years ago. Minnesotans didn't change, this body changed. And I think it's important that we return to that same spirit of bipartisanship, because that's really what Minnesotans want. The bill gives women options, and it's really simple. But right now, I want to talk about some things that were said. Unregulated. Unregulated was said. The reality is, Democrats rejected regulations for settings like Planned Parenthood who do invasive medical procedures. They didn't want licensing in those settings. When we offered that, you said no. Positive alternative grants through places like a pregnancy resource center and a maternity home are not doing invasive medical procedures. The second thing is, I heard people say, we're not licensed. That's true in the sense that the buildings aren't licensed on either side, for either side of the grants that we fund. It's true at Planned Parenthood and it's true at the resource centers. But what they didn't tell you is that every single professional licensed person is licensed. The RN, the doctor, the medical director. I have been to these settings and they have that. They are as equally licensed as the ones that are in Planned Parenthood. Second, maternity homes I heard were never funded. That's like a new thing in this bill. Well, that's not true either. Members, we funded through this body maternity homes. The Philomena home in this city of St. Paul lost $149,790 because the grant is a multiple year grant, 4-year grant, I believe. It ended. Real loss to real women. North Maternity in Duluth lost $72,023 of their grant in a maternity home. In Hibbing, in northern Minnesota, they lost $148,046. That's just facts. We funded them before. So I heard about, let's not deceive people, then let's tell them the truth. This is not a new thing. It was going on for 17 years from this chamber. Number 3, let's talk about monitoring. I heard people say of their experiences, but in 2005, when this program started, there was a lot of due diligence done. Because you know what? They put third-party compliance for pregnancy resource centers where they were audited by foundations like the Wilder Foundation. People that were pro-choice audited these places and said they were super impressed. Are the same auditings happening at Planned Parenthood? Auditing has happened from 2005 to 2017, or 2023, for 17 years. So when you ask yourself if your experience, I'm sorry if you had an experience that was different, but I'm talking about from 2005, when we had grants that have compliance with the Minnesota Department of Health reviewing, to 2023. Number 4, records. I heard that there's no confidentiality. That's just not true either. That's in the bill. If you read the bill, you saw it. We talked about that at committee, of confidentiality and records. We don't want records to not have that, and we don't want breach of records for any organization that we're giving money. We talked about settings. The settings seem different. I think you're going to find scrubs. I think you're going to find paperwork. I think you're going to find magazines and seating, whether you go to Planned Parenthood or you go to a pregnancy resource center. And when the doctors are there, you're likely going to see a stethoscope. That's just absolutely insanely ridiculous to make statements like that. Grant applications, number 7 that I'm going to talk about. They have grant applications right in the contract for these that talk about the conditions and the terms. That was from 2005 to 2023. There was actual wording in there for everybody to have clear guidelines so that some of the things you were talking about would not happen. And I'm not aware of any that have happened in that time frame. We talked about pregnancy resource centers not needing the money. Okay, well, we had 77 pregnancy resource centers in 2023. We have 73 now. 77 to 73, so 4 have clearly closed. And you're right. People will give money, whether they're giving money to the sexual and reproductive health grants. We just heard 990s. Billions are in that organization. And so, yes, people will give to make sure that women have options. But let's be truthful on both sides of it. Because the funding exists in the sexual and reproductive health grants for $25 million from the state of Minnesota. It exists. This bill for positive alternative grants has never taken away money for abortions, to get birth control, to get the services that are done there. What it took away is car seats, clothing, diapers, supplies. I've been to them. There's just rooms full of it. That's what it took away. It took away ultrasounds, not an invasive procedure. That's what it took away from women in Minnesota. It's unfortunate that was a simple bipartisan decision for 17 years has become political, because Minnesotans, 80% of them agree with exactly what I wrote in this bill. Just let us make the decision. The reality is women do not need government to arbitrarily limit choice and options for women. So this isn't about abortion. Abortion's fully funded, same as it's been. So tell the truth and be honest to Minnesotans. What's not funded is the alternative options for women. That's the truth. And yeah, there's been some egregious misallocation of funds, but not in the category of pregnancy resource centers and maternity homes. I haven't heard one claim of that in the state of Minnesota. But I've heard about $600 million of misallocated funds and fraud. But it hasn't been here. And we have a fraud committee in the state of Minnesota now, as of 2025, that would be hearing that, should that ever be a reality. But the fact is, the system had controls to have audits for compliance. Members, there was safeguards for 17 years. There was common sense for 17 years. It is that simple. It is simply giving women options. Women are not naive. Every one of us have this phone to find out what's in a 20-second radius, a 20-mile radius, to pick. I don't need the government to tell me, and I don't think anybody else does either. Nobody's forcing. The contracts are pretty clear. I've read them. It's a supportive service on both sides of the aisle. And nothing changes with this bill, members. What this bill does is give women options. Members, let's restore what happened for 17 years. That's what Minnesota expects us to do. This is about as bipartisan as it gets. It's not taking away from anything, it's adding. Members, vote yes.
The clerk will take the roll. The clerk will close the roll. There being 67 ayes and 65 nays, the bill does not pass.